Audio testing audio.
August 30th, 2021 Health Committee meeting to order, which is actually our September meeting being held in August. We have all members present except Member Bloomfield and Member Beer. Member Beer has some car issues, so she was not able to make it to the meeting today. We have minutes to approve from August 2nd of our regular meeting. Do I have a motion? Motion by Chung, second by Johnston. Any additions or corrections? All in favor? Any opposed? Okay, that carries. We have no members of the public today, so then we will move on to departmental matters. First up is Jason Tabb from Juvenile Detention.
Good afternoon.
You have your report. Is there anything on there that you'd like to comment about? Anything?
No, pretty straightforward.
Okay.
To answer any questions if you have any.
Anybody have any questions? Member Johnston.
Just a quick question. Given the heat that we've been having, I know that we're going to be authorizing later, we'll be voting on the cooling system. Is it going to be done after the heat's over so that it won't cause a disruption to staff? And
I believe so.
Sure.
The new system is scheduled for the fall.
okay,
So we should be, if we can get through this heat right now, like we're doing, we should be good.
and the system's holding okay?
It's holding up okay.
Okay. All right. Thank you.
Anyone else? Okay, thank you.
Thank you.
Next is Jessica McKnight, Health Department Administrator. And if I could ask committee members and department heads to move their microphone closer to them when they talk with their masks on, because it's harder to hear. Thank you.
Hello.
Hi, you have your monthly report. Is there anything that you'd like to say about it?
Nothing to highlight, but I'll be happy to answer any questions.
Questions for Ms. McKnight? Member Johnston.
I'll go again. Thank you. I'm very appreciative of that we have gone back to the daily reports, barring the weekends. Is there a particular reason that we are not including like hospital bed availability anymore? Just so that the public is aware?
Nope, it was something that was taken off when we were doing weekly reports, but we can look to add it back to the daily.
If we can add it back in. Yeah, with the surge that we're seeing in other parts of the country, obviously that's an issue. Not here, but some hospitals are having overflow in parking lots. I think it might be reassuring for people to understand that what kind of availability we have here. So thank you.
Thank you. I guess I was just, in your report, you kind of talk a little bit about this third dose. I was just wondering if you are going to do anything different from the first time around when, people signed up for doses, or, I know we kind of seem to maybe come up with something that worked, but I was just wondering if you're going to tweak anything a little bit for when that happens.
So far for the third dose, which is available now for immunocompromised, haven't needed to do anything differently because it is such a small percentage of the population. And for boosters, we still don't know exactly how it's going to roll out. So we are planning to just continue with the scheduling method that we have. It's been working pretty well, but we also are still offering by appointment in the office. So at the health department, we have them available, and then if need be, we can roll out mass vaccination again through our bigger sites.
Anyone else? Member Johnston.
Thank you. I just had one question. I was contacted by a constituent who is involved with the theater system locally. And while the mask mandates are coming out about kind of indoors and recommendations about restaurants and whatnot, there hasn't been any specific guidance for like kind of entertainment venues. So I didn't know if that's something that you needed to speak to IDPH about, or if you had a soundbite that we could give them as far as what recommendations they have. Obviously, the audience, they're expecting them to still be masked, but do the performers need to be masked? What is that protocol just so that we can try to stay within guidelines.
Yeah, I can verify with IDPH that it is still the same, but when Phase 5 rolled out, kind of how prior to Phase 5, we had specific guidance for, like you said, yeah, entertainment, this kind of gathering and that type of gathering. And when Phase 5 rolled out, they kind of did away with that and had one guidance for all. But now that we have the mask mandate basket back in place, I can definitely check on that to see if there's going to be any changes.
I think it'll keep changing again rapidly like we did before, and then it kind of settled down, and now it might change rapidly back and forth in different areas, so. Anyone else? Nope. Thank you.
Thank you.
Next up is nursing home administrator.
So if you've read through your packet fully, you'll see that in the monthly report, we had the resignation of Terry Edens occurring in the past month. And so with us today is our interim nursing home administrator and director of nursing, Kim Bolster. So on the bottom right, where
bottom
it looks
right.
like the person
Yeah.
speaking out. Yep,
There you
right
go.
there.
Got that on. Okay. So you have 2 items for action. One is request approval of a facility agreement with Bridges Community Services. May I have a motion? Motion by Chung, second by Johnston. Would you like to explain that, please?
It's pretty straightforward. It's just a licensed clinical social worker support for the residents.
Any questions, comments? Member Johnston.
Thank you. As a social worker who does counseling, I was very glad to see this in the packet and that it's being done in a way to provide as much access to the patients or to the residents as possible without costing our budget. They can go directly through the insurance. So I'm hoping this will be a huge boost to residents as they're adjusting to different issues as we continue to go through the waxing and waning of COVID issues. So thank you guys for putting that together and
you.
bringing that on board.
Okay. Member Metzger.
How were these services provided in the past?
We had a different service that was provided, but all through COVID, they did telehealth, and they went through a staffing issue the same way multiple places are. They were no longer able to provide services.
Okay, thank you.
Anyone else? Okay, all in favor? Any opposed? Okay, that one passes. And the next item is request approval of an agreement with Meridian Health Plans of Illinois, and that's on 15 through 60. And I have a motion by Martin, second by Johnston. Say anything about that?
No, it's another form of public aid. We have had a couple people that we have had to turn down for referrals with them. So it's just another service that we're able to do at the nursing home.
Any questions? Does this one pay faster than like Molina?
I don't know about that.
Okay. Hearing no other questions, all in favor? Any opposed? Okay, and that carries. So we have your monthly report. Is there anything that you would like to point out on that, or? I mean, I think, did everybody go to the open house? I did, and I remember seeing you, and you missed it. It was cool. I love the floors. You know, I think that the floors really make it a lot better, so warmer looking. So anything that you'd like to point out?
No, it was a wonderful turnout. I appreciate all the support from the board, obviously, and the community as well. We have had quite a few referrals and accepted. We actually had an admission down there today. So it seems to be working well.
Good. Okay, any questions? Member Metzger.
I think I'll address this to Ms. Dreyer, and I know you've told us this before, but our expenses are significantly up. And I think, is that with health insurance or payroll? I can't remember why the expenses are significantly higher this month. Page 63. Oh,
Oh.
There we go. From what I've seen, because I noticed that as well, it appears that the agency nurse expense is higher in August. I don't know if there was a timing difference, like, because it was lower in July. So I don't know if we got some July bills in the beginning of August, maybe that's why there's a jump.
Thank you. Any other questions, comments? No? Okay. Thank you. Next is Suzanne Scott, Adult Detention Medical. And she is not
Suzanne Scott could not be here tonight. She is working the floor
Again.
at the jail again. Um, So she did tell me some positive news about recruitment, and so I'm hopeful that she can be here next month because it sounds like they have some potential um, new recruits for that division.
Okay.
But I am able to present this for action if you'd like.
Okay.
So the request for action is approval for a memorandum of agreement with Positive Health Solutions, University of Illinois College of Medicine from Peoria, and McLean County Jail Medical Unit. This was the item that was presented last month that was tabled for more information, including the executive summary memo, which I have included for you. So these services are available to our residents in the McLean County Detention Facility, whether we have an agreement or not. This agreement just allows for jail medical to have more of a understanding of the services that they can provide through Positive Health Solutions. And I believe it's a good show of faith to this underprivileged or unrecognized area of jail medical. And so if you have any further questions, I'd be happy to answer them to the best
Okay.
of my ability.
Can I have a motion, please? Motion by Johnston, second by Chung. Any questions? Okay, hearing none. All in favor? Any opposed? Okay, that motion passes. And then her general report is also in here. Are there any questions on that? No? Yes? Okay. All right, then we will move on to Ms. Taylor, our interim county administrator, and she has an item for action.
Thank you, Chairman Schaefer. So the next item that I present to you for your consideration is the request for approval of an emergency appropriation ordinance amending the McLean County fiscal year 2021 combined annual appropriation and budget ordinance for the American Rescue Plan Fund. This is the very first presentation that we bring to committee in relation to our ARPA funds. And I can tell you that the reason that this is the first is because we have been very deliberate and intentional in our planning for these funds. We realize that this is a one-time event, probably in the history of McLean County, that we will receive this volume of funds, but we also want to make sure that we are utilizing these to the best of our abilities across as many departments that we can and for the uses that they were intended. And so I would say that this use that I bring for you today, which is to offset the nursing costs that are allowable under the CLFR to control the spread of COVID-19, is exactly what the ARPA funds were identified for, to offset revenue lost or to offset additional needs due to COVID. As you have been aware from the many months before when we've discussed this with the prior administrator, we have had difficulty finding nursing staff during this pandemic, and we've had to rely more and more upon our agency partners. And that is costly during a pandemic. And so I bring this action item for your consideration.
Did you read that?
Mhm.
Oh, you did, okay. Can I have a motion? Motion by Martin, second by Chung. Any comments or questions? Hearing none, then, all in favor? Any opposed? Okay, and that carries. Do you have anything else you'd like to comment on?
My only other comment will be when you get to the bills and transfers.
Okay, on the other business communication, we have 3 items. Our next meeting is going to be on October 4th. And so then that kind of ties into the second item, which I believe Ms. Morlock had sent everyone a question about starting early because of getting it all done in one meeting. What was the results of that?
Thank you, John. It seemed that most people could do that. I know that Member Chung had an issue that she probably couldn't be here until after 4 o'clock that day. But I believe I received positive responses from everyone else that they could do 3:30 or 4 o'clock. So that, I'll leave that up to the committee then.
Okay, so do we want to make it 3:30 or 4? Member Chung?
I think that, well, my issue was my children and picking them up, but I think I'm just going to pick them up early that day. I can be here probably by 3:30.
Okay.
So, thank you.
Is that okay with everyone, 3:30? Okay. Consensus is 3:30 then for October 4th. So that actually changes our next meeting. And then we have the issue of December 6th meeting time with the city moved their council meeting because of holidays to December 6th. So if we could move up till 4 o'clock, move a half an hour earlier to make sure we get done in time, which usually isn't a problem, but you never know. So is that all right with everyone to move it up for a half an hour on December 6th? Okay. All right. Anybody else have any other business or communication? Oh, Chairman McIntyre.
Have permission to speak, Ms. Schaefer? Madam,
Yes, for
can
permission
I
to
have
speak.
permission to speak briefly?
Yeah.
Thank you. I just, for your information, and maybe many of you know this already, but they are starting to give booster shots out now, COVID boosters. There's a limited supply. Our local hospitals, GPs, and pharmacies do have them, and they are making them available, but only right now the supply is so limited that it's only to immunocompromised people. So if anyone asks, the word is out on that. So hopefully soon they'll get more in and everyone else can take advantage of that. Thank you.
Anyone else have any other business or communication? Okay, on to paying bills. First is the Board of Health with a prepaid total of $285,221.23. Motion by Chung, second by Johnston. All in favor? Any opposed? Okay, that passes. Next is Developmental and Disabilities Board with a prepaid total of $6,451.51. Motion by Martin, second by Chung. All in favor? Any opposed? That passes. Jail and JDC Medical have a prepaid total of $42,155.63. Motion by Martin, second by Johnston. All in favor? Any opposed? Okay, that passes. And finally, the nursing home has a prepaid total of $424,736. I have a motion by Chung, second by Johnston. Ms. Taylor.
As you prepare to pay these bills, I want to draw something to your attention. In previous committee meetings, this committee has asked for information related to any fines that we receive. And so I want to be completely transparent and let you know that included in the bills this month is a bill for a fine. This is related to a survey that we received back in December of 2020, so it has been that long ago. But it was related to an infectious disease. We did ask for a desk review on this issue, and they disagreed with our assessment. We disagreed with their assessment. And so it took several months for it to be resolved, but we have recently received a fine from CMS related to that. As you know, and as we've even mentioned in this meeting today, the regulations are changing all the time with related to COVID, and we are in compliance with those regulations every time they change, and we are in compliance today.
Anybody have any questions? Okay. All in favor? Any opposed? And that passes, so if there's nothing else, this meeting is adjourned. Thank you all.